future nurses. Welcome back to Injecting Knowledge, your go-to channel for nursing study tips and exam prep. Today, we're diving into a topic that's critical for nurses to understand: dysrhythmia disorders. We're going to break down what these disorders actually are, what causes them, and how they affect the body. We'll also take a look at some EKG strips to help you recognize them in practice. Let's get started. So what exactly is a dysrhythmia? A dysrhythmia or arrhythmia is an abnormal heart rhythm caused by issues in the heart's electrical conduction system. The heart relies on a precise sequence of electrical impulses to contract and pump blood effectively. When something disrupts that rhythm, it can lead to beats that are too fast, too slow, or irregular. There are many types of dysrhythmias, and while some are harmless, others can be life-threatening. They can lead to poor circulation, blood clots, stroke, and even cardiac arrest. There are several factors that can cause or contribute to dysrhythmias. Some of the most common ones include electrolyte imbalances, especially potassium, calcium, and magnesium levels. Heart disease, such as coronary artery disease, previous heart attacks, and structural abnormalities, can all disrupt the heart's rhythm. And high blood pressure. This puts extra strain on the heart, increasing the risk of electrical disturbances. Other causes include medications. Certain drugs such as beta blockers, stimulants, and even some over-the-counter meds can impact heart rhythm. Excessive caffeine, alcohol, or drug use can also trigger irregular heartbeats. And lastly, stress and anxiety. The release of stress hormones like adrenaline can sometimes lead to palpitations or irregular rhythms. Dysrhythmias are categorized based on their speed and origin. Let's break them down into three main types and look at their EKG strips. Bradycardia, which is slow rhythms, is when the heart beats too slowly, usually under 60 beats per minute. Common causes include SA node dysfunction or heart block. An example of this is sinus bradycardia, which can be normal in athletes but dangerous if it leads to fainting. Tachycardia, which is fast rhythms, is when the heart beats too fast, over 100 beats per minute. A common example of this is sinus tachycardia, where the heart rate increases due to factors like fever, dehydration, anxiety, or excessive exercise. It is usually a physiological response rather than a life-threatening condition. A more serious example of this is atrial fibrillation, or AFib. This is where the atria quiver instead of contracting normally, increasing the risk for stroke. And the most serious and most deadly is ventricular tachycardia, or VTAC, which is very deadly if untreated. The next category we're going to be talking about is irregular rhythms. These include conditions where the heartbeat is chaotic or unpredictable. An example of this is atrial flutter, which has a sawtooth pattern on an EKG. Another example is PVCs, or premature ventricular contractions, which can be harmless or a warning sign of more serious problems. Symptoms vary depending on the type and severity of the dysrhythmia. Some people don't feel anything, while others experience palpitations, which is feeling like the heart is skipping beats, dizziness or lightheadedness, shortness of breath, chest pain, fatigue, and in severe cases, fainting or cardiac arrest. If you or someone you know experience severe symptoms like chest pain or fainting, it's a medical emergency. Call 911 immediately. How are dysrhythmias treated? Treatment depends on the type and cause of the dysrhythmia. Here are some common interventions. The first intervention is lifestyle changes. Reducing caffeine, quitting smoking, and managing stress can help prevent certain dysrhythmias. The next intervention are medications. We're going to administer these patients antiarrhythmic drugs, beta blockers, and blood thinners. The next intervention are pacemakers and defibrillators. Devices like pacemakers help regulate slow heart rhythms, while implanted defibrillators, or ICDs, can correct dangerous fast rhythms. And lastly, cardioversion and ablation, procedures that reset or eliminate faulty electrical pathways in the heart. It's crucial for nurses to recognize symptoms early and provide appropriate interventions. Even a simple task like monitoring a patient's pulse or oxygen levels can be life-saving. And that's a wrap on dysrhythmias. Understanding these disorders and recognizing them on EKG strips is essential for both nurses and nursing students. So I hope this breakdown helps simplify things for you. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more nursing content. And as always, happy studying and stay confident. I'll see you in the next video. Bye, guys.